Here we go. Katie, welcome to the program. Thanks for joining us.
Good morning. Thanks for having me.
Thank you so much for coming out. I really appreciate it. And I still feel like a new mother myself, even though she's 4 years old. It's like a trauma that you don't get over. The birth.
It's true. I feel the same way with my 5-year-old.
Now I understand why my mom is like, you're my baby. She's, it's still right in there.
Yep.
So the Center for Disease Control and Prevention, according to them, half of all maternal mortalities in the U.S. are preventable. Why does the United States have the highest maternal mortality rate in the developed world? Why are Black women so much more likely to die from childbirth? Shea Barrett is here to discuss. She is the founding executive director of the March for Moms, a mom of 2, a postpartum hemorrhage survivor. She has 15 years of leadership experience in healthcare policy and health system transformation. And I'm very happy to have you on the case because my experience was unpleasant, would be an understatement. And I am happy to be alive post having my child in the hospital. You are a postpartum hemorrhage survivor. Can you tell us what your experience was like with childbirth?
Sure. It sounds like we may have had similar experiences. I had 2 very healthy pregnancies. So I have a daughter who's almost 9 and my son, Will, who's almost 6. 2 very healthy pregnancies with midwives at a hospital outside of Boston where I live. And, had no idea about postpartum hemorrhages and the impact that had on women's lives and disproportionately, as you mentioned, Julianna, on Black women and women of color. So I had a totally normal pregnancy, went in, and then ended up having a hemorrhage after birth, had a quick birth with my second 3 hours, and then ended up hemorrhaging. And so needed to have obstetric intervention, blood transfusion, the whole 9 yards. And, I ended up fine. I ended up, having quality healthcare in a hospital with the team of midwives and OBGYNs and nurses and my doula and my husband, who all acted together to make sure that I was okay. As a public health professional, I'd worked in health policy for a long time and never worked in maternal health, had this personal experience and was like, oh my God, I can't believe this happens to women and the trauma that I experienced. And most importantly, I met a number of Black women who had the same clinical presentation that I did, and they ended up in the ICU and ended up really nearly almost dying. And that's just
because they were not believed.
They were not listened to. They were not listened to, so my team responded as soon as something was happening to me to make sure everything was okay. Black women are not listened to. There is rampant racism in the medical institution, and particularly Black women giving birth. And that's why we have the horrific rates that we have today.
Talk about the issue of maternal mortality in the country. Why are women dying in childbirth?
Yeah, it's actually both mortality and morbidity. So to sort of decode the public health speak, morbidity is what I experienced, which is hemorrhage, it is preeclampsia, high blood pressure, things like that, which are very serious conditions that women experience in pregnancy and in childbirth, and actually can happen up to a year postpartum. So even if you think about mental health issues postpartum, so those are morbidities, right? You don't die, but you experience something very serious. Mortality.
That's interesting. No one even asks you to come back. You come back after you have a baby 6 weeks, and then they're like, "Good luck," and that's it.
And then they're like, "See you later." Right? Exactly. And that's not okay. So that's some of the work that we advocate for is to see women sooner, 2 weeks postpartum, more often, right? And then don't just sort of leave them out after 6 weeks. So good luck. Go back to primary care. Good luck to you. We really need to take care of women through the whole first year postpartum, because maternal mortality, about a third happen in pregnancy, about a third happen around birth, and a third happen up to a year postpartum.
I'm glad I didn't know that.
It's
already scary enough, just the pregnancy, you worry about your own health, the baby's health, and then the birth is not something that people generally look forward to.
The system is not set up to take care of us. And that's the root of all of it. That's why we have these dire rates. And that's why, you had your experience and I had my experience, is that the healthcare system is not set up in terms of insurance coverage, in terms of how providers are trained to really holistically care for moms during that time.
I know it. You probably paid out of pocket for a doula, and then you probably had to carefully to find midwives who would deliver in a hospital, because hospitals don't like having midwives in there because they're like a soft touch. The hospital's like, here, hang off this bar and we'll come back in 45 minutes. Good luck to you. You know,
And midwives stay with you while you're in labor. That's why
Yes.
I chose it. Yeah, for sure.
It's absolutely ridiculous. Can you talk about what's happening in other countries? Why we're not doing well when it's compared to other countries.
Yeah, and I think it's that point of midwifery-led model of care. So that is one thing that we advocate for here in the U.S. is better payment and better integration of midwives into the healthcare system, because the rest of the world uses midwives for most births. We use specialized medicine for most births in the United States, and that's a clear distinction. We also have health insurance system that makes no sense. And so in other countries, they have nationalized health insurance. People don't lose their health insurance. Right now, women are eligible for Medicaid coverage, but they lose it 60 days postpartum because you're only eligible for those 60 days. Having a 2-month-old and then losing your health insurance coverage seems like the stupidest thing in the entire world to me. So health insurance coverage and the midwifery-led model of care, I think, are the two big differentiators between the United States and the rest of the world.
Can you talk about the racial disparities in maternal mortality a little bit more in detail? Why are Black women so much more likely to die from childbirth than white women?
Sure. So the statistic is that Black women are 3 to 4 times more likely to die in childbirth. And the statistic that you mentioned at the beginning is that 3/5 of those deaths are preventable. This is a public health crisis that we have the solutions for. In fact, a lot of the solutions have already been proposed in Congress, and that's what I recently wrote about in an editorial in The Hill, is that legislation has already been introduced to solve this crisis. There's the Black Maternal Health Caucus's Momnibus set of 9 bills that have been proposed. There's Medicaid extension to 1 year postpartum through the Mamas Act that has already been proposed by Congresswoman Robin Kelly. Congress just hasn't moved on these things. And
is that a Mitch McConnell thing? They're just like,
well, the Senate
women,
hasn't picked it up.
Yeah,
the Senate hasn't picked it up. And I think particularly in these COVID relief packages, those are the solutions that we need. And Congress is hamstrung, and the Senate in particular has not moved.
Well, yeah, not the Senate in particular, because it's Republicans. I know maybe you don't want to get political here, but basically what it comes down to is Republicans don't care about Black women dying. They want their vote, but they don't really care about Black women dying. Otherwise, they would have passed this. That's just it is.
It's hard to politicize this issue, right? It's a public health crisis that is compounded by another public health crisis of COVID, compounded by another public crisis of racism. And so, if any issue deserves attention right now, it is Black maternal health. And it should be a bipartisan issue.
What are the things in this bill that would help, that maybe also point to the issues? I mean, when we say racial problems, do I think, oh, the doctor just doesn't care? What is in the system that causes the numbers that you're seeing? And what's in the bills that would unravel it?
Sure. I think one of the big things is payment for community-based doulas. And so if the issue is that medical providers are not listening to moms, a doula's job is to advocate for what the mom needs throughout, to support her in pregnancy, but mostly during that birth and labor process, stay with her, support her, and advocate for what she needs. So in theory, that should be what everybody has. And as you mentioned before, I had the privilege of being able to pay out of pocket for somebody to do that for me. We need Medicaid and other health insurance companies to pay for doula. That should be a given. Every mom should have a doula to be able to support her through birth. And that's what one of the bills in the Momnibus does, support investment in community-based doulas to do that. The other big thing, just going back to health insurance coverage, right? So 60% of Black births are covered by Medicaid, at least in my state, Massachusetts. Medicaid pays for half of all births in the United States. We need Medicaid to be able to have comprehensive coverage for moms through a year postpartum, to be able to pay for the community-based interventions, home visiting once she goes home, doulas, those kinds of community supports.
Oh, I would have loved home visiting.
That moms need, right? And to be able to check on her. It doesn't need to be a doctor, it doesn't need to be a nurse. It needs to be someone from her community to come and check on her and make sure she has what she needs. And so those are some of the things in the bills that would make such a huge difference, and really are no-brainers.
One of your recent pieces said that the CDC says that they have no way of knowing the official maternal mortality rate. How could that be?
Well, you go back to prioritizing women's health. We have not prioritized.
Has there ever been a female head of the CDC?
That's a really good question. I don't know.
Let's get up on that. Let's get that
Right.
going.
Right. So it's prioritizing data collection for issues that matter, and then, prioritizing the collection of race and ethnic data and language data to be able to stratify those measures to understand the disparities. So part of the issue is that it's really a state by state data collection effort. And there was great movement on that on the Preventing Maternal Deaths Act, which was passed at the end of last year, but it's not enough. We really need to be able to have the data to drive policy change. But as I said before, we have the solutions. We just need to act. Data collection is one part of it, but we really need the solutions.
If no one is paying attention to moms, and if they die a year postpartum, if no one's, they're not going to connect it, are they? If you just drop dead from whatever, they're not going to say, oh, this is maternal mortality, a high blood pressure spike, a stroke after, 8 months after a birth. Is that right?
There are these things called maternal mortality review commissions, which sounds a little bit like death panels, if we remember that from the health insurance debate a couple of years ago. But it is a commission of clinical leaders, researchers in each state that reviews every case. And then they make a determination about whether it was, what was the cause of death, and then does some quality improvement with the hospital. But it's after the fact, and not every state has one of these. Mm-hmm. And not every state has a robust quality improvement structure around it.
So let's talk about what we can do to improve rates of maternal survival. Do we call Mitch McConnell and say, hey, could you take up this mama bill? It's called the mama bill, right?
It's called the Mama's Act. Yeah, 100%. Our website has a lot of great advocacy tools at www.marchformoms.org. We have a whole advocacy page and goes through step by step how to call your congressperson, how to call your senator. There's even stuff you can do at the state level. Call your local state rep, your municipal leaders, because this is a problem that requires intervention at all levels. And so it's not just calling your federal lawmakers, but also calling your local lawmakers and asking for them to pass these bills at the federal level that we've talked about, the Black Maternal Health Momnibus and the Mama's Act. But then locally, asking your state to invest, asking your state to expand Medicaid, because that's something that states can do, take the ownership over doing their own. And most importantly, if you're a mom who had the experience like the two of us, share your story. That's the most powerful thing that people can do to be able to drive change. If people don't talk about it, people aren't going to pay attention to it. So you need to be able to share your story and demand change.
Thank you so much for joining us today. This has been a really important conversation, and I hope we can continue to have these conversations. I feel like I haven't heard about this in the mainstream. It's all like some guy's tweets, some guy, we know the guy, as opposed to like real things that are happening that people are actually doing that may be successful.
There are great things going on. So we'll try to amplify them. And thanks so much for having me on, Julianna.
We're speaking with Katie Barrett from March for Moms. You can follow her on Twitter at KS Barrett, BARRETT 515, or go to marchformoms.org. Thanks for watching. And thanks again, Katie. I really appreciate you joining us today.
Thanks for having me.
I'm Julianna Forlano. You are watching ACT TV. Thank you so much for joining us today. I hope that was useful to you. I hope it was. I thought it was useful to me. There's not, childbirth is super traumatizing. I don't know a lot of people who have these, it just came out. That's not, it's highly unusual. Anyway, like us on YouTube if you're watching on YouTube. Or do you like on YouTube? No, you like on Facebook. You follow on Instagram. You friend. I don't know. It's all confusing. Y'all know what to do. We'll see you tomorrow. I believe Ryan Grimm may be on the show tomorrow. He's scheduled to be on the show, but it's an iffy. So if not, I'm sure we'll have somebody else who talks about the important things that are going on. Thanks for watching. We are out of here for today. Have a great day.